The first month of life is a crucial period for survival, as this period carries the highest risk of deaths per day than any other period during the childhood. In India, the National Newborn Week 2020 is observed every year from 15th to 21st November. Union Minister of Health and Family Welfare, Dr. Harshvardhan, has chaired an event to mark the National Newborn Week 2020. The main purpose of the week is to reinforce the importance of newborn health as a key priority area of the health sector and reduce the infant mortality rate by improving healthcare conditions for babies in the neonatal period. The theme of National Newborn Week 2020 is Quality, Equity, Dignity for every newborn at every health facility and everywhere. In 2014, India became the first country to launch the India Newborn Action Plan in alignment with the global Every Newborn Action Plan towards eliminating preventable deaths of newborns and stillbirths.
Healthy newborn. A healthy infant born at term between 38 to 42 weeks should have average birth weight. Crisis immediately following birth. Establishes independent rhythmic respiration and quickly adapts to the changed environment.
Immediate basic care. There are 5 points. First one, maintenance of temperature. Second one, establishment of open airway and circulation. Third one, identification of newborn. And fourth one, vitamin K injection. And fifth one, initiation of breastfeeding. First is maintenance of temperature. We should immediately dry the infant under a radiant warmer, and skin-to-skin contact should be provided with the mother. The neonate's head should be covered. Baby should not be separated from the mother. Second one is establishment of open airway. When the head is delivered at birth, the attendants immediately suction the secretions and wipe the mucus from the face, mouth and nose. Suction the nose and mouth by using a bulb syringe, and keep the neonate's head slightly lower than the body, and position the baby on the back. The importance of suctioning is, as the fetal chest passes through the birth canal, it is compressed, squeezing excess fluid out of the lungs prior to the baby taking his first breath. After birth, the babies will cough and sneeze, mobilizing additional fluid that may be in their lungs. Next is Apgar scoring. In that, we can check several things: respiration, heart rate, muscle tone, reflex response, and skin color. The score is 10. Newborn identification. Before a baby leaves the delivery area, identification bracelet with identical numbers are placed on the baby and mother. Babies often have 2 on the wrist and ankle.
Vitamin K. Vitamin K prevent neonatal hemorrhage during first few days of life before infant is able to produce vitamin K. Administration. Term infants 1 mg IM, preterm infants 0.5 mg IM. Alternative routine. Oral dose 2 mg orally at birth, repeat dose 2 mg at 3 to 5 days and at 4 to 6 weeks of age. Initiation of breastfeeding. Babies can be breastfed as soon as the airway is cleared and they are breathing normally.
Daily routine care of neonates. The majority of complication of the normal newborn may occur during first 24 hours or within 7 days. So close observation and daily essential routine care is important for health and survival of the newborn baby. Then the major goals are establishment and maintain homeostasis, stability of normal physiological status. Then the daily routine care of the neonates are as follows: warmth, breastfeeding, skin care and baby bath, care of umbilical cord, care of the eyes, clothing of the baby, general care, observation, taking anthropometric measurement, immunization, follow-up and advice. First one, warmth. Warmth is provided by keeping the baby dry and wrapping the baby with adequate clothing in 2 layers, ensuring head and extremities are well covered. Baby should kept by the side of the mother. Breastfeeding. The baby should be put to the mother's breast within half an hour of the birth or as soon as possible. The mother has recovered from exertion of the labor. Skin care and baby bath. The skin should be cleaned of blood, mucus and meconium by gentle wiping before he or she is presented to the mother. Baby bath can be given at the hospital or home by using warm water in a warm room gently and quickly. First bath. Once a baby's temperature has stabilized, the first bath can be given.
Cord blood collection. Make sure cord blood is collected for analysis and sent to laboratory for checking of RH blood type, hematocrit and possible cord blood gases. Care of the umbilical cord. Keep the cord stump clean and dry. Topical application of antiseptic is usually not necessary unless the baby is living in a highly contaminated area. Care of eyes. Eyes should be clean at birth and once in every day using sterile cotton swabs soaked in sterile water or normal saline. Separate swab for each eye. Clothing of the baby. The baby should be dressed with loose, soft and cotton cloth. The frock should be open on the front or back for easy wearing. Large button, synthetic frock and plastic or nylon napkin should be avoided. General care. Roaming in, gentle approach, aseptic technique, sensory stimulation, tender and loving care. Observation. The baby should be kept in continuous observation twice daily for detection of any abnormalities. The Tropometric Measurement. Measure weight, length, head circumference and chest circumference. Weight. The average daily weight gain for healthy term babies is about 30 grams per day in the first month of life. It is about 20 grams per day in second month, 10 grams per day afterwards during the first year of life. Length. From top of head to the heel with leg fully extended. Average range 18 to 22 inches or 46 to 56 cm. Head circumference. Average range 33 to 35 cm or 13 to 40 inches. Normally 2 cm larger than chest circumference. Place tape measure above eyebrows and stretch around fullest part of occipital at posterior fontanelle. Chest circumference. Average range 30 to 33 cm or 12 to 13 inches. Normally 2 cm smaller than head circumference. Stretch tape measure around scapule and over nipple line. Immunization. Newborn should be immunized with BCG vaccine and 0 dose of OPV. Hepatitis B vaccine can be administered at birth as first dose and other 2 doses in 1 month and 6 months of age. Follow-up and advice. Each infant should be followed up at least once every month for first 3 months and subsequently 3 months interval till 1 year of age.
Harmful traditional practices for the care of neonates. Use of unclean substance such as cow dung, mud on umbilical cords, immediate bathing, use of prelacteal feeds, application of kajal in newborns' eyes, installation of oil drops into ears and nostrils. During bathing the baby, use of unhygienic herbal water, use of pacifiers, introduction of artificial feeding with diluted milk, giving opium and brandy to neonates, and use of ready-made expensive formula foods.
Essential newborn care is a comprehensive strategy designed to improve the health of newborns through interventions before conception, during pregnancy, at and soon after birth, and in postnatal period. So, we must give much importance in caring newborns for their proper growth and development.